I am Michaela Patterson, and this is for Clinical 470 for athletic training, and I attend Manchester University. So the literature says that you should start doing self-breast examinations at around age 20. This is when you finish puberty. They also say not to perform this near or around your period or menstrual cycle because your breast can already be swollen or tender. And they try to perform this once a month. So pick a date that is consistent and easy to remember for you. So for example, my birthday is October 11th, and so I could always do this on the 11th day of the month, as long as that is not around the menstrual cycle. Okay, so to perform the technique, they say to start in front of the mirror. And this is to check the size, shape, and color between the two breasts. They say next to raise your hands above your head and check to make sure they are still the same. Upon raising your hands, sometimes the effects can change. So next you would lay on your back and raise your corresponding arm with the corresponding breast. So if you were wanting to check your right breast, then you would raise your right arm, place it behind your head, and then examine it. And so the way to examine is you go from the sternum to the armpit, and then from the clavicle to the abdomen. And so on our doll here, our clavicle would be up here with the abdomen, and then our sternum all the way to our axilla or armpit. So the best way to do this is you're going to go in a circle and then move your circle in. You're also going to use about 2 to 3 fingers to palpate. And when you do this, you're also going to want to make a circular motion with it. So, say you start up here with your clavicle, you're going to press, kind of circulate, and you're just going to keep going in a circle. And you're just going to keep going in a circle and then move in. And you are feeling for lumps. Some people have lumps naturally, so you want to note any changes from the previous month. So they say to keep a log if you need to. So one source that I used said that this really isn't a prevention technique, but rather a detection, because you're not really preventing the cancer from happening. Instead, you are detecting when you feel like you could have cancer because of the lumps. And so I did find another source that said that 20% of breast cancer is first examined because of self-exams. So this could prevent late detection cancer. And self-exams prevent late detection of cancer, especially if they are routine. If you are performing them monthly, you could find these breast cancer or these lumps early on, making that the later cancer and prevention rather than detection.